So I'm going to talk to you about how we've used virtual patients in the TAME project. So an overview I'm going to give you about how St George's uses virtual patients and a bit of background about our virtual patients, then go on to talk about the TAME project and why and how we did this, show you an example of a medical error case, talk a bit about the evaluations that we've done, and then at the end show you a little project video. So this is a picture of how St George's delivers its problem-based learning. As you can see, it's still the same traditional type of PBL that was delivered, with a group of students sitting around the table and having a discussion with a facilitator. So we implemented this interactive online problem-based learning in around 2009. And the only difference here is that the students actually project the case on an interactive whiteboard. They work through the case, they're presented with some options and consequences. Just something to note that the students don't see the options first. They do have an opportunity to talk about it and discuss it beforehand. Once the tutor feels that they're ready to move on, they're presented with the options. So this allows them to have a good discussion. So about the TAME project, it stands for Training Against Medical Error. It's funded by the European Commission under its capacity building programme. 3-year project was started in October 2015 and completes in January. And we have 10 project partners. So this is a map to show you where the project partners are located. We have Karaganda State University, who are the coordinators of the project, but also a partner in implementing the cases. We have St George's University of London. Then we have Masaryk University in the Czech Republic, Karolinska Institute, Aristotle University of Thessaloniki in Greece, and the partners who implemented this are Bukovinian State Medical University, Zaporozhye State Medical University in Ukraine, and then we have Astana Medical University from Kazakhstan as well. And then from Vietnam, we have Hanoi Medical University and Hue University of Medicine and Pharmacy. So the project objectives were to develop a VP methodology to enable future physicians to avoid making these common medical errors. Wanted to transfer the knowledge and experience that we have within our institutions to these partner institutions. Use the example of studies that we have in different clinical attachments of different disciplines, and use networks such as this to disseminate what we found. So why did we do this? So some of you may have seen this before, and it says, "I just killed the baby." And she says, the poorer the choice the student takes, the richer the learning experience. So what we wanted to do was we wanted to build on this. And past studies have shown that students remember things when things go wrong. So we wanted to build on this. We wanted to target avoidance of error by allowing students to make mistakes. Often people are always taught how to do it right and not really emphasis on the errors and what you can actually learn from when you do things that don't actually go to plan. We wanted to develop the clinical reasoning skills in practice-based elements. And we also wanted to bridge the gap between medical, university-based teaching and what you see in practice. So sometimes in traditional environments, students don't always relate the two together. So this was quite useful. We wanted to allow students to think, make decisions, and act on those consequences that they see. So how did we do this? So St George's University of London provided 6 cases in paediatrics to the partner countries, who then adapted their curriculums to include these cases. They adapted them to local languages in the healthcare setting. So they changed the dosage, they changed the cultural differences, such as the wordings that they use. They tested this with their staff and students, so to see that they were functioning well and they were readable and usable for their students. They delivered it using Open Labyrinth that you've heard about, the software that we use to develop our open virtual scenarios. They created assessment instruments that Terry mentioned earlier, so the MCQs that they developed, and they assessed their students on that. And then they went on to create 6 paediatric cases in their own chosen subject areas. So we had internal medicine and infectious diseases and a few others as well. Once they did that, the process was repeated. They tested their cases with staff and students and assessed their students on that again. So along with this, we've provided training with them. So that was a big part of the project as well, to provide training. So we had, first workshop was on repurposing virtual patients. So how do you take an existing virtual patient case and repurpose it to different languages and different local healthcare settings? And this is can be a challenge sometimes if you're not quite aware of what you're doing. Also, how do you deliver PBL training? So interactive PBL training, so how to facilitate a PBL setting. Then to go on to actually how to write an error case was the other one. And the last one was actually case review training, which we think is quite important. And one of the important steps when you're doing this, you need to review and review and review again to make sure, because you've got to think, you've got 8 students sitting around the table, so it can't be a simple answer of next or move on. So I just wanted to show you an example of a VP case. I don't expect you to read that. There's a lot of text on there, and that's deliberate. And this is to illustrate that when you're in a real-life situation, you are presented with a lot of information at any given time. So the idea of these virtual patients were to pick out that information. And just to highlight a few bits here, so it shows you, we've got who you are, some statistics down here, and what you can see. And then if you scroll down the page, so this is still the same page, scroll down, there's a bit more information. And again, time's moved on and students have to pick out that relevant information. So this again is to illustrate that in real life, you will be given a lot of information. This is when medical errors can happen. You've got a lot of information and you've got to try and deal with that. You're also presented with some images as well, or some clinical findings. Once the students are ready, they've got some options there and they can choose of how to move on in the case. So this is a case map of that case, and it's just to illustrate how the cases are structured. So you can see you're starting off here, that's your first page, and you've got 3 options through the case. At the end of the case, you're provided with a case commentary, which summarizes what's happened in the case and the actual errors that were contained within it. So just to highlight some of the evaluation that we did for the thing, we had 3 main groups that we wanted to evaluate from. So we had the learners, so we had the experience motivation surveys and their experience surveys. We had the tutors, the experience survey, and the tutor-trainer written interview. So this was the train-the-trainer approach that we used here. We then had the case writers, those who adapted the cases and those who actually created new cases as well. And then finally, the case implementation. I'm not going to show you any of the results that we've got here because this afternoon, Luke's going to talk about some of the findings from the Karaganda Medical State University. So we'll leave that till this afternoon. So just moving on, this is an actual video that was created by Aristotle University. And it just summarizes the project.
Training Against Medical Error, or TAME, is a joint project funded by the European Commission to strengthen cooperation for innovation and the exchange of good practices. It is funded by the Erasmus Plus program for capacity building in higher education and coordinated by Karaganda State Medical University based in Kazakhstan. The overall aim of this endeavor is to improve training methodologies in order to minimize morbidity resulting from medical errors.
The TAME project is actually an idea that I've been working with for many, many years. Actually, is basically how do you change how people behave so that they become safer.
TAME started in 2015, and until 2018 the consortium has innovated curricula in 6 medical schools of 3 countries: Kazakhstan, Ukraine and Vietnam.
Kazakhstan right now is in the process of reforming medical education, and this Erasmus Plus project, Training Against Medical Error, was just right in this time.
I think this project is a unique chance for medical students and for all medical universities of TAME consortium to implement virtual training against medical error in medical.
Teaching staff in these institutions have been trained to new teaching methods and new means of curriculum delivery. They have integrated digital resources and implemented the virtual patient methodology via DPBL, decision problem-based learning.
Хочу выразить благодарность нашим коллегам в этом проекте, которые оказывали всестороннюю методологическую поддержку. Студенты учатся принимать обоснованные лечебно-тактические решения.
Лично для меня, как для тьютера, она позволила повысить мой потенциал, уровень.
Knowledge and experience on virtual patient cases and on educational innovations has been transferred from European institutions. The study was initiated by adapting pediatric cases developed at St. George's, University of London, as exemplar studies, and then create new cases in different disciplines.
Each of the 6 cases we tried to map out that covered the paediatric curriculum, but also covered an error curriculum and focused on 10 errors that we saw as the most common sorts of problems that people had. So once the cases had been mapped out, then it was a question of turning them into scenarios that would be engaging and involving for people who are actually going through them, and that would work in a PBL context as well, because it was important to us that the cases wouldn't just be real but could actually be used by PBL tutors, and then we'd get a whole group going and excited about them.
The TAME project is built on the partnership we had with St. George's, University of London, and successful projects like the EPBL Net project. It's the first of its kind to try error-based training on multiple institutions.
The supra-regional network of national centres in medical education, MEFINET, WAVES, and other associated networks have contributed to the success of the new developments and the sustainability of project outcomes.
Masaryk University is proud to be a part of international cooperation like TAME. This project helps to share know-how between all involved partners across the world and introduce new innovative pedagogy methods to medical and healthcare education.
Project outcomes are already visible in the evaluation results.
It's actually one of the most interesting, in fact probably the most interesting project we've ever worked upon. I think not just because we've put in a tool which is obviously very good for decision making and for training against error, but it's also the amount of data that we're collecting which shows that just how people actually do think, how making mistakes virtually and safely can actually influence long-term memory retention. And perhaps most of all, that people actually quite enjoy the challenge, but sometimes they actually also find it quite stressful.
The consortium has managed to enrich technically and pedagogically their teaching of medicine and create a learning environment more attuned to medical practice and patient safety.
One of the things that we're now learning is that we can actually make these projects not just about building capacity, but actually about generating a fair amount of research potential in the partners as well, and out of the partnership, that benefits everybody, that everybody grows. It's the growth, I think, which is perhaps most important.